The Personalised Ramping Framework was conceived and developed by Dr. Samir Parmar and is now incorporated into the Lithotripsy Academy ESWL certification training. When we talk about modern SWL, we should not think of it as one continuous block of shockwaves. It is a sequence of carefully designed stages, each with a different biological and mechanical purpose. We begin with the renal safety phase. In the first 100 or so shockwaves, the energy is kept deliberately low. This is not about breaking the stone. It is about preparing the kidney. Low energy pulses trigger a mild vasoconstriction inside the renal tissue, which reduces blood flow and makes the kidney more resistant to injury. This simple step has been shown to significantly lower the risk of renal hematoma and tissue damage later in the treatment. Once the kidney is conditioned, we move into the stone sensing phase. Here, the energy is slowly increased over the next several hundred shocks. Stones are not uniform blocks. They are made of layers, each with a different hardness and density. By gradually stepping up the energy, we allow shockwaves to probe these layers and create microscopic cracks at natural weak points inside the stone. This phase does not aim to break the stone apart yet. It prepares the stone so that when higher energy is applied, it breaks efficiently instead of resisting. After this preparation, we enter the fragmentation phase. This is where most of the real work happens. At a stable, optimized energy level, shockwaves are delivered consistently for the bulk of the treatment. Because the stone has already been sensitized and weakened, these shocks propagate through the internal cracks and split the stone into progressively smaller pieces. The goal here is controlled fragmentation, not brute force. Good preparation allows effective breakage at lower stress to the surrounding tissue. Finally, we move into the fine fragmentation or dusting phase. In the last 200 to 300 shockwaves, the energy is reduced again. At this stage, we are no longer trying to break a large stone. We are refining what remains, turning small fragments into fine particles that can pass more easily through the urinary tract. Lowering the energy also protects the kidney from unnecessary trauma at the end of the session. So SWL is not just about how many shocks you give or how high the power goes. It is about how you move through these stages in a thoughtful, step-by-step way, respecting both the biology of the kidney and the structure of the stone. That is what turns a machine into a clinical tool.